Anxiety. Symptoms, types, causes, prevention, and treatment. Anxiety is a natural emotion that often triggers increased alertness, fear, and physical symptoms, like a rapid heart rate. However, when anxiety becomes excessive, it can impact daily life. Understanding the difference between normal anxiety and anxiety disorders is crucial for seeking proper treatment. Anxiety disorders are mental health diagnoses that cause extreme nervousness, fear, and worry. They can lead to physical symptoms such as shaking and sweating. According to the Anxiety and Depression Association of America, ADAA, around 40 million Americans have some form of anxiety disorder. The American Psychological Association, APA, defines anxiety as feelings of tension, worried thoughts, and physical changes like increased blood pressure. Knowing when anxiety requires medical attention can help individuals identify and treat the condition effectively. Anxiety often results from real or perceived threats, triggering cognitive, physical, and behavioral changes. This response is known as the fight or flight reaction. Sometimes, the intensity of these feelings can be disproportionate to the original stressor. When anxiety reaches the level of a disorder, it can interfere with daily functioning. Anxiety disorders can manifest in various forms, each with unique symptoms and triggers. The DSM-5-TR classifies these disorders into several main types. Generalized anxiety disorder, GID, involves chronic, excessive worry about everyday life events and situations. It is the most common type of anxiety disorder and often lacks a clear cause. Panic disorder is characterized by sudden, intense attacks of terror and apprehension, often without a recognizable trigger. Specific phobias involve a fear and avoidance of particular objects or situations. Unlike other anxiety disorders, phobias have a specific cause. Agoraphobia is a fear of places or situations where escape might be difficult or help unavailable, often misunderstood as a fear of open spaces. Selective mutism affects some children who find it impossible to speak in certain contexts, despite having adequate verbal skills elsewhere. Social anxiety disorder involves a fear of adverse judgment or embarrassment in public, affecting various social interactions. Separation anxiety disorder brings high anxiety levels after being separated from a person or place that provides security. Though common in children, it can affect all ages. The causes of anxiety disorders are complex, often involving multiple factors simultaneously. Environmental stressors like relationship problems, genetics, and medical factors such as symptoms of disease can contribute. Substance withdrawal is another potential cause. Effective treatment often involves a combination of psychotherapy, behavioral therapy, and medication. In some cases, underlying conditions like alcohol dependence or depression need attention before treating the anxiety disorder. For milder anxiety, self-treatment techniques like stress management, relaxation exercises, and maintaining support networks can be effective. Counseling is a standard treatment, often involving cognitive behavioral therapy, CBT, to change harmful thought patterns. Various medications can also help manage anxiety, including antidepressants, benzodiazepines, and tricyclic antidepressants. Benzodiazepines, like diazepam, may be prescribed but can cause addiction. Antidepressants, such as serotonin reuptake inhibitors, SSRIs, also target anxiety. Tricyclic antidepressants are useful for most anxiety disorders except OCD. Other medications include monoamine oxidase inhibitors, MAOIs, beta blockers, and buspirone. It's essential to seek medical advice if prescribed medications lead to severe adverse effects. Coping strategies like taking timeouts, eating balanced meals, and limiting caffeine and alcohol can help manage anxiety. Deep breathing exercises recommended by the UK's National Health Service, NHS, can also be calming. Breathing in through the nose and out through the mouth, while counting from 1 to 5, can help reduce anxiety. Stressful life events and lack of sleep can worsen anxiety, making stress management techniques crucial. Consulting a primary care doctor is often effective for mild anxiety, while more severe cases may require a psychiatrist. Anxiety is a vital natural emotion for survival, but becomes problematic when exaggerated. Anxiety disorders like panic disorder, phobias, and social anxiety require proper treatment involving therapy, medication, and lifestyle adjustments. An active lifestyle and balanced diet can help manage anxiety levels. Learn more about anxiety and its treatments to lead a healthier, less anxious life.